Viewers Global Window laga team aaj bishi important ekta topic loi gine ahine ase itu to HIV AIDS human immunodeficiency virus aro acquired immunodeficiency virus ami kan sob jane ki duniya de HIV AIDS to bhari gine jai ase iniga nishna India de sai shuri do Mizoram to highest hoigine ase with 2.70% aro itu laga next to second highest to Nagaland de ahigine ase Nagaland de 1.36% iniga bimar loi gine ase to itu laga pore ami khan district hospital de Dr. HOTOKA HESSO SMO Art Plus Center District Hospital Dimapur tai gibi ami khan viewers khan karne jankari nohili bi awareness laga pore alop huda hudi kuri sabo itu laga details pore sai sabo to viewers HIV AIDS to beta virus ase etu ami khala body di jaise ule ami khala immune system do weak kuri de aro HIV AIDS to ki ase ule do edo sobse ekta advance stage ase HIV laga virus loi gine to ami khan duniya de bi bishi bhari gine jai ase iniga nishna India de bi saise ule do Mizoram he sobse highest hoi gine ase etu la next to Nagaland de ahi gine ase Nagaland de ase guli bi Dimapur do highest ase etu gane aji ami khan alop awareness program laga nohili bi lop huda hudi kuri gine jankari lobo gine aji ami khan Dr. HOTOKA HESSO SMO Art Plus Center Dimapur District Hospital logo de ahi gine ase ahi bi tai gi lop huda hudi kuri sabo thank you so much for giving your time to Global Window to sir eta question hudi bole mun thaga do HIV joldi detect dura bara HIV progress hoi gine jadu kiniga impact kore
see early detection early treatment we are saying rapid ART initiation early detection can save life HIV bimar positive ase gena jana para manu namuru dawai bhal bara thik time de start koro parile okay so how it is impacting is see without HIV treatment HIV bimar na janile treatment korobo na pare to HIV bimar na jana tok to tai laga khun de HIV virus to it's multiplying in terms of lakhs in a day so what is happening is it's attacking and destroying the immune system so on a daily basis immune function is going down and therefore it is very important very important to detect at the earliest to preserve the immune system immune function of the person who is infected with HIV and early detection and early treatment will reduce the progression to HIV disease. What I mean by HIV disease is HIV laga bimar do na jani na thagile progress hogina jai ase. So within matter of few years ito HIV disease hoi jabo which is called AIDS. To ito dangor bimar de fashibo manu morabi morubo. To ito ani joldi start koro parile ta laga immune function and ta laga disease progress na kori jabo. So it is very important. The third part is the treatment will help reduce the transmission to others. If in a family, the married couple, then his treatment is a prevention for his partner. So we call it treatment as prevention. It is very important to save another person from getting infected. So all these are benefits which comes with early detection. So HIV laga bimar to olopi suspect thagile to in the lifestyle in the past history joldi HIV test kurubo lage khun ulebi so that we should not wait for symptoms to develop which may be too late so early detection and early treatment is the answer for this treatment
to sir kwanishna sob cities te thaga manu han nohoi town te thaga manu han nohoi holubi itu laga bimar to jaga de filai ni jaine ase to tahan kinega janibo what will be the symptoms tahan inia bimar hoshugile do kinega hoy first HIV AIDS laga symptom do
see HIV is actually a chronic disease to shuru de kitaba HIV it's a viral infection to shuru de HIV lagia time te to we call it acute seroconversion or acute viral illness to just like any other viral infection it headache nausea body ache all these mild symptoms will be there sometimes swelling of some lymph nodes in the neck So these are some of the sore throat. This can be the symptoms and it will subside. And after that, it will slowly progress without any symptoms for years and years. So without testing, as we have discussed, it will not be known, the early symptoms. And over a period of time, after 5 years, after 8 years, once the disease progresses to AIDS, then there will be weight loss, there will be different malnutritions, there will be AIDS-defining illnesses like TB, candidiasis, cancers, all those will come at the end.
तो और एक ता होदिउले मुन थाका तो जनता खान गे आसान बरा बुझिबुले पारिबो निमिरे HIV तो किनेगा ट्रांसमिट नहोबले फिलिगिने जा आरो इटु बरा किनेगा बाजिगिने थागिबो आमी खान जनता खान इटु लगा पडिबो कोइ दिबो
There's only 4 routes of transmission for HIV. HIV एकता बरा एकता गे लागिबोले खाली 4टा रास्ताय आछे and HIV तो एकता STI निसिना कन्सिडर करे sexually transmitted infection. Itu matlab to ekjon manu pura ekta HIV thaka manu logot unprotected sex kora time te HIV ekta pra ekta ge lagi jai. So that is the most important route of transmission. Our second route of transmission is through needles, especially in the last 5 years, say after COVID, especially among the young people in Dimapur areas, there's been a high use of drugs, IV drugs. So that has increased the HIV detection also among those drug users. So what it means is through needles, sharing the infected needles. Because for a person who is into drugs, they are least bothered about HIV. So they want their next dose. So that way they don't take care. So sharing the needles or needle stick injuries from the infected blood. So this is an important route of transmission for HIV. Our third to mother to child. So a mother who is HIV positive, तो अम्मा एकता इतु बीमार थाकिले ताई ट्रीटमेंट भालबरा नलइले तो ताई लगा बच्चा के HIV लागिबले चान्स तो 20 to 40% चान्स थाके तो तिनीले भी भालबरा इतो आमा एकजन बीमार आसे गना जानी जाइगे ना जल्दी ट्रीटमेंट करो पारिले तो बच्चा के तो बचाओ पारे तो आजिकाली तो बेसी आमा खान दवाई ठीक खाइगे ना ताला बच्चा खान तो HIV ना लागिगे ना पाइ थाके और खुमा मानो ART भालबरा खाइ ता खान तो बच्चा खान भी एकता दुईता तीनटा भी लोबो पारे आजिकाली तो with the benefit of the treatment that is available. And the fourth route of transmission is blood transfusion. So blood transfusion तो खून लगाते में भी एकदम साइके ना टेस्ट करेंगे ना ही ब्लड ढालिबो लगे ना साइके ना इमरजेंसी ऐसे कोई ना खून ढाली ले तो एकदम डेंजर हो जाबो किला इतु बीमार लगी जाइले न होबो सो इतु चारटा रास्ता पर हुसार থাকিলে तो बीमार इतु ना लागिबो तो আমি আন ভাল ভাবিলে ইতু কিনা ৰনা ইতু बीमार না লাগিব লাগে গলে তো একটা তো ইনাকা জানকাৰী তখন জানি কেনা হুসাৰ থাকিব লাগি আছে তো ইতু হুসাৰ থাকা ওপৰতে আগে দে কোৱা নিচিনা মোস্ট ইম্পৰ্টেণ্ট ৰুট তো STI থ্ৰু STI আছে তো খুমা মানুহ STI গুনা সেক্সুৱেলি ট্ৰান্সমিটেড ইনফেকশ্যন তো HIV কোৱা তো STI আছে নে HIV per se does not have any clinical symptom of STI तो घाव नाइ प्राइवेट पार्ट्स खान देखो बीमार ना दिखे नोले तीनोले भी खुम्मा मानो STI থাকিছে গলে like syphilis like gonorrhea इतु बीमार खान थका मानो तो HIV तो 10 times higher to get transmit to others or get transmitted so इतु आने खुम्मा मानो STI लगा symptom आसे गले जल्दी treatment লৈ লব লাগে so that we can prevent the HIV transmission so इतु আছে আৰু ইতু লা ওপৰতে কন্ডম চলাব লাগে কন্ডম চলাই থাকিলে তো ইতু বিমাৰ পৰা 99% তো বচাব পাৰে আমি একটা ফৰ্মুলা চলাই থাকে আমি কিতাবা অ্যাৱাৰনেস খান দিয়া টাইম দে ABC ফৰ্মুলা কই very simple ইতু প্ৰিন্সিপল ঠিক চলাব তো এ তো কি আছে গলে abstinence the only sure way of preventing HIV transmission is abstinence. Itu, especially young people, they should not take their life or health for granted, but they should be very careful and they should abstain from unprotected sex so that they don't get HIV. Second thing, if they cannot, then they have to be faithful. B stands for being faithful, and C stands for consistent use of condom. So itu han follow kuru paribo lagi ase. So itu han pra follow kuru parile aru itu la oporte dawai khumba ase. Itu prevention arni. Ekta do PEP koi, itu post exposure prophylaxis. Kumba by mistake, by accident, inaka HIV person logot expose হৈ যাইছে নহলে বি suspect হৈ যাইছে কি HIV বিমাৰ মানুহ লগত ইটো expose হৈ গনা আছে গুলে তো দাৱাই আছে ইটো দাৱাই খান ঠিক 28 days লাগা কোর্স আছে একদিন দেখতা খাবো within 72 hours চলাব লাগে তো ইটো চলাব পাৰিলে তো to some extent it is preventable আৰু PrEP কুইং নামে একটা দাৱাই আছে ইটো প্রি এক্সপোজার প্রোফাইলাক্সিস সো কুম্বা কাপলস তে একজন পজিটিভ একজন নেগেটিভ আছে পার্টনার্স খান আৰু তাহান একি লগত থাকি আছে গুলে তো ইটো হান এডভান্স পৰা ইটো হান চলাইলে তো একটা পৰা একটাকে বিমার না লাগে সে a couple who wants to conceive but the other partner is positive and they don't want to take chance then they can avail this PrEP which is available in privates ito cholai gena prevent kuro parbo lage thank you
তো ইতিয়া নিমিৰে HIV বিমাৰ নিমিৰে কি ইলাজ আৰু ইটো ইলাজটো বিমাৰ খিলাফ লৰাই কৰা দে কিমান এফেক্টিভ আছে সো
HIV লাগা ভাইরাস কে মুৰাবলে দাৱাই আছে ইটো গে ART কয় এন্টি ৰেট্ৰোভাইৰাল থেৰাপি সো ইটো দাৱাই do একদম ভাল দাৱাই আছে very effective and it is proven that even within 3 months of treatment that HIV is suppressed in the blood of HIV positive people so HIV laga dawai khai ta time de within 3 months bitor de to tala khun de to HIV negative nishnai hoi jai but the treatment has to go on it's a lifelong treatment very simple very effective one tablet in a day and that we have used it as a first line of drug it's a combination of 3 drug to 1 tablet to ito hodai ek din de ekta khabo ekta timing maintain korina cholabo lagibo aru itu cholai thaka tok to tai laga life will go on tala immune system will start recovering within few months to years aru itu dawai bhal bar cholai thaka tok to tai laga dawai do itu first line treatment goigena cholabo to itu cholai thakibo aru kumba mano dawai change korobo lagile whether because of side effects or because of the treatment failure matlab kumba mano dawai ulta pulta kha time de dawai kam na kori hoi jabo pare dawai effective no hoi jabo to itu mano hange to dawai badli korobo lagi jay so itu ge second line dawai goina alak dawai tagi dibo aru itu nishina aro dawai itu dawai to kam kuri ase na nai mehan ekdom closely monitor kuri thaki ame ala patient khange to itu monitor kuri gena bhal bara treatment thik time de dawai badli koribo lagi jabo so that they don't develop resistant HIV virus ina kuri gena second line bra aro third line facilities itu facilities kan sob ame ala ART center te available ase
তো HIV medication la common side effect khan to ki ase aro itu kinega manage kuribo
see HIV treatment ART is well tolerated hardly any serious side effects but few people can have some side effects like any other drugs like nausea fatigue headache these are the common side effects which can happen especially in the beginning first few weeks to first few months bitore khuma manolop tolerate koro na para manu bi thage complain thage kiteba but most of the time it will subside to hoi jai kiteba we may need to give them some medication to help relieve the side effects aro if you think about ART side effect kumba to long term bi hobo pare cholai thagi gena kumba manu na milile they can undergo some kidney problem তো itu ane mehan kiba problem thakile mehan monitor kori thake moina the first 3 months is very important to monitor the side effects. তো কিবা প্ৰব্লেম থাকিলে তো আমি চাই কিনে এইটো হিচাপতেহে দাৱাই বদলি কৰিব লাগিব, নহ'লে তো ছাইড ইফেক্টটো মেইনটেইন কৰিব পাৰে। কোনোবা মানুহ লাইফষ্টাইল প্ৰব্লেম পৰা ছাইড ইফেক্ট প্ৰব্লেম বি ওলায়, লাইক alcoholics, drug users। তো তাহান লগা প্ৰব্লেমটো আমি ভাল পৰা হেণ্ডেল কৰিব লাগে। ইফ দেৰ ইজ চাম আণ্ডাৰলাইং liver problem, kidney problem, or for some people like diabetes, if there is some drug interaction nohobole karone we have to analyze. So for some category of patients it will be personalized treatment devo lagi jabo, so that the patient is able to have the best ART medicine with less side effect.
যদি HIV থাকা একজন জলদি ইলাজ কৰি কিনে থাকিয়ে সামাইদে দৱাই খান ঠিক পৰা খাইছে গলে তো নৰ্মাল মানুহ নিচিনা লাইফ স্পেন থাকিব পাৰিব।
Yeah. So early HIV detection and early treatment, as I said earlier, etu tai laga virus to under control de ahi jabo, we call it virally suppressed. So for such patient there is no difference about life expectancy between HIV positive person and HIV negative person. It's the same thing, life expectancy. Life should go on. The responsibility lies to continue the treatment regularly on a daily basis and monitor the regular blood test. There's a blood test called HIV viral load test. It helps us to understand whether the patient is virally stable or suppressed. And accordingly, if the person continues the treatment, then lifespan is same as another non-HIV person. One problem we are facing these days is non-communicable disease. HIV person is considered just like another person. It's a chronic disease which is managed like another non-communicable disease like diabetes and hypertension. So many people are suffering from those. So we have to take care of those areas. And fortunately, in our own ART Plus Center, we have an NCD clinic where we are daily monitoring our patients for diabetes, hypertension, cervical cancers. All this we are able to detect so that we give them the good quality care, so that they don't just die of HIV, but they don't die of other non-communicable diseases.
HIV বিমাৰ থাকা মানুহ খান নিমিতে কি হেল্থ সাপোর্ট আর রিসোর্সেস আছে?
HIV patients, those who are registered with us, they do HIV testing from any other ICTCs, and when they come and register with us, then we are giving them all the facilities free of cost. So one thing is the blood test, whether it's the CD4, whether it's the HIV test, whether it's the viral load test, whether it's a baseline blood test. Baseline blood test to ki ase gole kidney function, liver function, hemoglobin, sugar, hepatitis B, C, VDRL. It wants to আমি একবার চেক করি when they come and register with us. So at baseline we do all of that test free of cost. We want to help our patients so that they know their baseline clinical evaluation and able to start their treatment. Aro CD4 কিনা একটা ব্লাড টেস্ট থাকে, তো ইমিউন সিস্টেম লাগা এইটো টেস্ট আছে, আৰু ভাইরাল লোড এইটো হন every 6 months or every 1 year depending on their response to treatment, এইটো আমি হান টেস্ট ফ্রি পৰা কৰি দি থাকি। So these are the treatment available. Other than HIV treatment, ART, we have other facilities like TB treatment. কোনোবা HIV patient খান তো বেশি TB বিমাৰ খান বি লাগি যায়, তো TB বিমাৰ খান লগা treatment, everything is freely available in our own ART centers, so they don't have to go anywhere. We will diagnose, we will treat from here, and along with HIV treatment, TB treatment, we do have support for viral hepatitis B or hepatitis C khan bimar thaka khan bi yete pura ami han tie up kuri kena through the National Viral Hepatitis Control Program in our institute. Tati ami han tie up kuri kena free bra hepatitis laga treatment, hepatitis C laga or B laga treatment bi di thake. আৰু opportunistic infection গৈ না কোনোবা মানুহ ডায়েৰিয়া নহলে pneumonia কিবা হৈ থাকিলে তো or fungal infections we have medicines to provide for to take care of those also.
Okay, to इलाज लोबले आहा HIV AIDS patient खान free बा दवाई पा खान तो avail करूबले आही ऐसा नहीं तहन भी.
Our center is ART Plus Center under Nagaland State AIDS Control Society. So, yete facility to sab free bra diye. So, whether it's the HIV medicines, ART medicines, or whether it's the TB medicines which is available with us, whether it's the blood tests like CD4 count or HIV viral load tests, all these tests are very expensive outside. So, but fortunately everything is available here. We do the HIV viral load testing Monday to Friday, like every day. Anytime patient can come in from 9 o'clock to 2 o'clock. They can come and avail the free HIV viral load testings or CD4 tests. Or kuma mane HIV asena nai jani bole mon thaka khando idu district hospital de ase idu ICTC koi to tati integrated counseling and testing center to yete ase idu be free bra test kuro pare hepatitis or other blood tests all these are freely available with us.
तो कौन इश्ना दो AIDS HIV AIDS बीमार हंदो मनुहन एक स्टिग्मा थकी जाए कि तहन बुई भी खाए सोरम भी खाए मनु के दिखावले कोई ने तो आमे खान हुनी पाए से कि यंग गर्ल्स खान इनेगा HIV AIDS बीमार होगी ने बच्चा खान भी बुखी ने प्रेग्नेंट हो जाए कोई तो अपने लगा सेंटर ये भी आई ने तहन आई ने इनरोल करी ने दवाई खान दो भी आई ने लोइना नो इतु लगा केसेस खान भी असना नहीं.
In particular, see HIV has affected the young category of patients. Okay, so if we categorize around 30% are among the age group of 25 to 50. Okay, and another 30% is between 15 years to 25 years. So young people are at high risk. So when we say young people, even if we see our current scenario in the last 1 year, the drug use is very high among the young people. So through injecting drug use, bishimano HIV lagigina tahan treatment lobole bi detect korigina ahigina treatment loy ase. Whereas if we see the young girls, yes, we do come across such cases. So, ekta maiki ekjon HIV ase goina na janingina thakigina risk thakile to joldi check up krubo lage so that they can save their life, number one. And second of all, as you said, if they get pregnant also, if they know their status and they are on treatment, they can save the life of the child and they can have their life. So inaka manuhan bi buhi na lagi na hibo lage yete do we keep very good confidentiality of our patients. We do not share or disclose their status, so there should be no fear to come and avail the facilities that are freely available.
अच्छा तो सर अपनी कौन इश्ना इतिया इनेगा यंग गर्ल्स खान इनेगा प्रेग्नेंट हुई गुले दो जल्दी इलाज करी गुले दो चांसेस कमती ऐसे मतलब बच्चा के लगी हुए चांसेस कमती ना किनेगा.
ओए एकजन मानो दवाई नखाइना प्रेग्नेंट থাকিলে HIV থাকিগিনা बच्चा के बीमार লাগিবলে চান্স বেশি আছে বেশি मतलब up to 40% চান্স তো আছে লাগিব ইটো বি নহয় না লাগিবলে চান্স 40% is very high. But ইটো মানো ইটো মাইকি তাই बीमार জানি কেনা তাই জলদি ট্রিটমেন্ট করব পারিছে বলে তাই লাগা ভাইরাস তো বাচ্চাকে না লাগি বলে 99% তো আমি বাঁচাই দিব পারে তার আমার কারণে বি বেনিফিট আছে আর বাচ্চার কারণে তাই লাগা আনবর্ন চাইল্ড or even after delivery breastfeeding for example breastfeeding tok bhi tai laga virus to control koro parche gule to breastfeeding can also be done. So basically life ke bachao paribo aru bachcha ke bhi bachao paribo.
अच्छा सर तो आपने ये हुदुले मुन था तो इत्या हमें हन HIV और AIDS लगा केस तो बेशी भारी गिने जाए ऐसे स्पेशली दिमापुर है तो की करने ऐसे is that because of unprotected sex ना तहां दो needles kan syringes kan दो share करा बरासे.
See, we used to categorize our patients as high-risk groups. Na, high-risk group kan kun ase kole khuma mano drugs chola mano han, drug users. Noile female sex workers koina, those who are involved in sex, or MSM, men who have sex with men, or these are the high-risk groups koina men koi thaki. Aji amihan kumba itu bimar hoina aha time te amihan taha laga itu routes of transmission itu compile korigina saile HIV laga bimar do among the young people itu drug use pra bishi manu bi lagi ase poila te to ini 3 to 4% nishina thakisile ne itia in the last few years itu the rate of transmission through drug use has increased to almost 9%. That means people who are injecting drugs, they are at risk of getting HIV, and that's what we are seeing, and we are working on that to reduce the transmission through this use. If I analyze the route of transmission, so it 80% through unprotected sex ase. So it could be through visiting those prostitutes or those having partners with multiple partners. So when a person is having multiple partners, then they are at risk to be having a relation with a positive partner also. Or if I see the 80% route of transmission through unprotected sex, it actually means it's in the general population. So everybody is at risk because 80% is actually in the general population. So one has to be very careful because these two are the main route of transmission if we see the scenario in our district.
Thank you so much, sir. Apni ra HIV AIDS laga opore bhal ra amen janta khan gi aro ami khan gi bhal ra bujai dingine itu laga bimari opore ami khan gi bhal ra explanation degane. Thank you so much.
Thank you, Global Window, for visiting our center. Thank you.
तो ऐसे डॉक्टर HOTOKA HESSO ताई SMO Art Plus Center District Dimapur Hospital लादे इरे ताई इंचार्ज ऐसे तो ताई बाबी कोई शिकी Alive and Art ते 7,000 plus निश्ना ताला center रे इनेगा आही ने ऐसे आरो 4 routes ऐसे आमी खान किनेगा HIV AIDS लगा रो किनेगा lagi jai kore do unprotected sex aro sharing of infected needles khan aro mother to child aro tuikla noine blood transfusion bra ami khan lage koi ni bi jankari digine ase aro antiretroviral therapy do ami khan lifetime lobo lage koi ni bi janai di ase aro taha laga center de bi free testing HIV khan nohili bi city count aro HIV viral load aro KFT noile bi LFT khan duhan bi sob facilities thakibo koi ni bi tai koi gine ase aro ami han jane ki India de ase goli bi Mizoram to sobse highest ase idu 2.70% de ase aro tu laga niche de second de aishu idu Nagaland ase Nagaland to 1.36 de ami khan itia jai ase to Nagaland de ase goli bi ami khan Dimapur de sobse highest hoi gine ase to ite ami khan ite laga center de agine doctor ki bi kotha ko homor emta bi ko ase ki free facilities khan iniga thakala imde ami khan sorombi nakhabi nohili bi buibi nakhai gine ami khan government khan bra ki ami khan ge facilities di ase itu ahi gine test kurubo lage kiman juldi ami khan test kuri gine dawai lo ase guli iman juldi ami khan laga virus khan to bi body de spread nukuri ne chances bi ami khan bajiwile chances bi thagibo koi gine ase hoi dunia de itia tok to HIV AIDS to cure hobo koi gine tu nai holibi ami khan kwanishna kiman juldi ami khan early detection hoy gine early medication thagi shule tade chances bishi ase koi gine bi janai di ase aro apni khan kiba diktar thagi shule bi Dimapur center ide ahi gine doctors khan laga modot pi lobi koi gine sob ki bi jankari janai di ase itia kane mana se for more news and update keep watching Global Window. This is your reporter Yaungamla with my camera person Anu reporting from District Hospital Dimapur.
DMI St. Joseph Global School, Chumukadima, in collaboration with Scholar Academy, offers top-tier JEE and NEET coaching, world-class labs, and skill building in robotics, swimming, and vocational courses. Admissions open. Shape your future with us.